We have to teach you early on that you have to learn how to work with others to give great patient care. So it starts in your first year with us. Actually, in your first year, you get a chance to meet people that come in from the various parts of the city that talk about what they do in the local hospital. So you can at least get an idea of the folks you're going to work with. In addition, we do this massive infectious outbreak simulation, and you work with nurses and epidemiologists from UGA trying to figure out how to save Athens from this infectious process. Sound familiar in this day and age? In the second year, we actually have a longitudinal approach. That simply means you're going to take care of a patient with physician assistant students from Augusta over the course of an entire semester. And you're going to see that patient again in March, believe it or not, in a physical assessment lab. So we try to do continuity so you're having the same patient, the same team members, and you're rounding on this patient for the course of the entire year. In your third year is what we call our big old fall IPE day. And basically, we have almost 350 people getting together to take care of a lady who has opioid use disorder who's come into one of the emergency rooms in town. You'll be working with nurse practitioners, second year medical students, social workers that are actually getting their master's and their bachelor's degrees, as well as us in our third year working in that team as pharmacists, trying to figure out how to give care to this person. Taking it one step further, we also get back together with the second year medical students in your third year, and we talk about value and ethics, one of the squishiest topics out there because there's no black and white. So it gives you a chance to talk about how you feel, what you're looking at. It's very important that we discuss the fact that we take care of patients from all walks of life. How do you feel about that? Where are your biases? It's important that we discuss all those things to make you a better practitioner. And then lastly, in your P4 year, your very last year, you'll go out on rotations. And according to the folks who've been out there, we do really great interprofessional phone calls, working with other professionals, working with other types of professions in general across the board, not just medical, to make sure that we give care to the patients of Georgia as best as we can as we go through those rotations. You're an integral part of the team in your fourth year. They can't do it without you. That's what makes UGA so strong in our community.